Hey, it's Dr. Allin here at Evolve Chiropractic in Woodstock. I want to talk to you about spinal stenosis. Recently, there was a study done on chiropractic care treating spinal stenosis, and they found that a treatment called Flexion distraction was highly effective in treating this disorder. If you go to a medical doctor with this condition, typically speaking, they'll prescribe some muscle relaxers, some anti-inflammatories, sometimes even bed rest. While these treatments might have a very short-term effect and a positive effect, sometimes they don't help at all, and the underlying cause is never really addressed. That underlying cause is actually a structural deformation of the canal where your nerves go through. It's a narrowing of the canal, and that's what stenosis means. So say you were to have a bulging disc in your back. So what ends up happening is there's compression of the disc material, and that disc material comes back into the canal where the nerves come through, and it creates a narrowing. And a lot of times that will create pressure on the nerves themselves, and it takes about the weight of a dime on a nerve to create a symptom. And that can be numbness, tingling, loss of function, anything like that. That is basically when you push on a nerve, those things can happen. So when we do flexion distraction, basically what we're going to be doing is creating a vacuum effect. So we pull the joints apart to allow space. And if there is a disc bulge pushing back, that disc bulge actually gets sucked forward via this vacuum effect. So I'm going to demonstrate this flexion distraction technique so you can see a little bit what it would look like if you were in the office getting this treatment done. Now we will stabilize the ankles at the base of this table here just so that we can now pull the pelvis away from the rib cage. So I'm sure some of you are familiar with the old medieval treatment called the rack. This is more of an updated version here, a little more technologically advanced, where we can really specify and dial in the amount of pressure that we're using. So I always like to start with a little bit of traction. So basically we're pulling the pelvis away from the rib cage, creating a slight bit of space in there. And then once we have that space created, we're going to do the flexion distraction portion, where when I unlock this table, I'm going to isolate the segment that we've diagnosed as stenotic or narrowed. We're going to block that segment, and then we're going to do repetitions of gentle flexion downward. Now, as we're tractioning outward, again, we're creating that negative pressure or that vacuum effect, which sucks disc material forward and gaps those joints that are stenotic. So if you have ligaments that are thickened because they've been degenerative over time, this will actually stretch those ligaments, creating a little bit of thinning of those ligaments and allow for that space to return to the canal where the nerve is exiting. So treatments are done. Usually we'll do about 10 to 15 repetitions on the affected segment. None of this should be painful. A lot of the times patients report how relieving this feels on the back, like right away. So very effective treatment. A really cool research article that just came out on that, which should be coming out in October of 2022. So keep your eye out for that if you're a nerd like me. But yeah, that's basically the treatment. If you have any questions on that, feel free to reach out to the office here or reach out to a chiropractor that does flexion distraction in your area. Be safe, have fun, get at it. I'll see you soon.